Good morning, everybody. So I just wanted to give you guys an update on how I've been doing. So since January, I started having more problems with my stomach, and my appetite basically disappeared. And I had some nausea, but no vomiting, just nausea, which kept me even more from eating. And then constant, like daily, multiple times a day, diarrhea. And I ended up losing almost 15 pounds since January 1st. And so I emailed my doctor. I said, hey, something's, I'm getting weaker and weaker, and it's getting harder to breathe, and this and that. And so we decided to take a break from the tucatinib, or the Tukysa, which is the pill form of a targeted therapy for my cancer. And when we did that, within a couple of days, everything started getting better. My energy started improving. My breathing started to improve. I was sleeping better. I was actually dreaming and remembering dreams, which I guess I wasn't doing very much of because I don't remember much before that. The GI, like I said, within 2 to 3 days, my stomach started acting normally again. My appetite's creeping back up. So I haven't gained any weight yet, and it's been about a week. So hopefully here I'll start getting some of my weight back. But I lost a lot of muscle mass. My legs have gotten a lot thinner, and my arms are more spaghetti-like, which I'm not used to. I'm more of a masculine woman, and I have lots of muscle. I had a lot of muscle and nice, big, strong legs, but now everything just looks piece of hay. He was out feeding. So I'm doing better. I'm not having to sit down every 20 steps to catch my breath or regain my energy. I'm almost functioning normally again. Still a little shortness of breath, but I have a pocketed pleural effusion, which scientifically they call that a loculated pleural effusion, which is instead of the fluid kind of floating around the left lung freely, it's in bubbles. And it's really hard to drain because you have to find a way to get the needle in there to pop all the bubble, but then you risk puncturing the lung, and we don't want to do that because that could cause a lot of problems. So you were only able to drain 3 of the pockets, which did help some. It wasn't a significant improvement like I was hoping for, but with the stomach problems improving, the lung problems are improving too. I also read in a medical science journal, not like the regular Facebook stuff or whatever, It's a medical journal where doctors and researchers publish their findings, and said that 2 days of dexamethasone could help reduce the fluid in the lungs, reduce inflammation. And so I did that. Today was my day 2, last pill for day 2, and I do feel better. So now I'll take off of the dexamethasone and just resume my regular pills and see how the lungs do. And if they start feel like they're filling up again, then I'll instate another 2-day dose just to kind of keep it under control. Hopefully the medications can kind of quiet down all the activity in the pleural sac, because there's a lot of activity according to my last PET scan. And I know some of that is inflammation, probably caused by the growing tumors in there, or the tumors that are dying. But like I said, unless you do a biopsy, how can you tell, right? So anyway, I just want to say I'm doing better. And the diarrhea really had a huge impact, the prolonged diarrhea. So if you're any kind of medical condition, if it causes a lot of diarrhea, that can make you feel terrible, especially over a long period of time, because your body starts pulling energy from your muscles, and if you have any fat, it pulls from your fat reserves, and you just get weaker and tireder, and just life doesn't feel like worth living at that point, because I wasn't able to clean my house. I was barely able to feed myself. When I did have something of an appetite, it was like I had to get up and cook. So I'll just grab a hot dog or something because I didn't have the energy to cook. So anyway, I'm doing much better. I'm cooking for myself. I'm cleaning again. So I just wanted to share the good news. Even though the treatment's kind of been really rough on me, this was a good news that feeling better finally. So anyway, I get my next PET scan mid-April, so that's about a month away. And if this treatment that I'm on now, which I'm going to resume the pills in a week, if this treatment that I'm on now does not show improvement, we're going to switch to Enhertu, which is another targeted therapy combined with Herceptin. So my treatments will be a little bit shorter, which would be nice because right now they're like 3 to 4 hours long. So it's basically my whole day's shot when I have to go get treatment at my doctor's office. But yeah, the IV version, for some reason, the IV version of the drugs that I take do much better for me. The oral routes, like the pills or the oral routes, they wreck me. Some people do really good on them. I did really good on Ibrance. I guess it didn't have a high propensity to cause diarrhea. But any drug that has a high propensity to cause diarrhea, I would prefer not to take. Because obviously, I had a Xeloda. It caused severe diarrhea and vomiting. And I had to go to the hospital. And that was the oral chemo that I'm on now. That the chemo I'm now is a sister drug to the Xeloda, which is, sorry, my nose is running. It's fluorouracil or 5-FU, and it's barely caused me. I mean, the hand and foot syndrome. You can see this. So this is about the time my hands would be bright red. There's a little bit of redness, but it's not that bad. You can see the peeling, and that's from when it gets really bad. It causes just a little bit of redness, but not too bad. The hands swell, and then the skin peels. So, and that can also happen to the feet, which did when I was on this Xeloda. So the Xeloda really hit my feet really hard. I was in a lot of pain. But my hands, they get, if I do anything that's like small objects and pinching and having to use lots of muscle, that will make them hurt. But that only lasts for about 3 days, about days 3 through 6. And I'm on got treatment on Thursday, so Thursday, Friday, Saturday, Sunday, Monday. So it should be by tomorrow, my hands should be back to normal again, which is awesome. Because trying to do zippers with your fingers being sensitive. Anyway, sorry, and the allergies are just kicking my booty. And none of the allergy stuff works, so sorry. Anyway, guys, so good news, feeling better, and I'll keep you up to date. If you have any questions, please leave them in the comment section. I will answer them. I also have a Facebook page called Life with Stage 4 Cancer. So I do a lot of little updates on there. Anyway, take care, guys, and live life, find your joy, and share your joy with others. Bye.